Hi, everybody. Thanks so much for joining this very important roundtable discussion with our close friend and colleague, Alex Fajardo from El Sol Neighborhood Educational Center, coming to talk to us about an incredible new product available to community health workers and their colleagues everywhere, the Community Health Worker Learning Hub. So, Alex, first of all, thanks for making this. Thanks for being here to talk to us. Tell us first a little bit about those that don't know El Sol. Tell us a little bit about you and your work with them, and what brought you to the need for incredible resource.
Thank you, Lance, for having me here. And my name is Alexander Fajardo. As you mentioned, I represent El Sol Neighborhood Educational Center. We are a community-based organization that was born in 1991, so more than 34 years,
Wow.
working with promotores and community health workers. El Sol has been a pioneer on community-based health work, especially to training across the nation and international. In Japan, we trained some CHWs maybe 5, 7 years ago. Our approach then is more grounded in popular education and collective care. So we trained CHW not just only as health educators or health navigators, but really to mobilize them to become advocates and community leaders so they can change the policy that they are living. Because we believe the health starts from the grassroots. Through trust, developing the trust relationship, I think the most important role of the CHWs, sharing the lived experience. So really our goal is to lift up the health and dignity of communities within they live and supporting CHWs across the board. So we have been training maybe since 2007, really enhancing the training through other agencies, and we have been supporting CHWs and any other entities in how to incorporate this model with this philosophy.
I love that. And, I think that a lot of us came to this work through similar reasons and try to embody those values in our day-to-day. Myself, I first got exposed to community health workers working in Mexico and specifically in Chiapas. I've never asked you this. What was your personal story for how you got into community health?
Actually, I was involved in my background from Colombia. So my brother was a community leader, trying to take, and many of my network was really helping youth not being involved in the political issues that we were living back then. It was more like a mobilizing youth to avoid to be recruited by the guerrillas and so forth back in my country. So it was more social justice background. And then when I came here to the States, I get into this work. But I think it's more like a social justice background.
And then that still remains so much a part of the way that we work, hopefully. And then also, community health is something that is for so many and available in great supply in some communities, but less in others. This product, when I came across it, I was very excited. I reached out to you to learn more about it. Why don't you walk us through exactly what the CHW Learning Hub is?
Let me give you kind of the background. So maybe through maybe the last 10, 15 years working with CHWs and supporting them, what they need always has been kind of where can I find these resources? I need this support. So getting received this support for CHWs. So we have been doing this work, and as you know, CHWs they done essential work, right? Most of the time they had not been recognized. But the pandemic brought the CHWs into existence, kind of.
Mm.
So many people found CHWs back then.
Found them in their own backyard. They were there the whole time.
Yes. But we start looking for, okay, there is where they can find resources, where they can find resources for their personal development, but also professional development, also resources when they are in the community. So we're not able to find any centralized place. So we did kind of the gap analysis with the local university. So we start interviewing CHWs across the nation, people that we already train. We interview supervisors, managers, even directors of what is needed for CHWs. And really we started doing the gap analysis. And the CHW Learning Hub, it was created really to support those gaps and really to support the workforce with tools that can be used for any CHWs, any promoter, anyone in their personal life, but also in their work. So this platform, the CHW Learning Hub, was created to be not just a moment right now, but really we're thinking for the long term and how we can support CHWs. Yeah.
And so looking at the website, one immediately sees educational materials, peer support forum, professional profiles, innovative technology and 24-hour support, interactive learning, mobile and desktop accessibility. These are touch points for best practices in community health worker participatory pedagogy. But can you walk us through a little bit of some of what makes this resource, unique, and what role it's providing in this larger ecosystem of community health across the US and beyond?
Yeah, I think I want to mention one of these languages that you can find bilingual. So Spanish, English, and if you look at it, we were planning to do all the languages. I think it's depending about capacity, but the platform, we can then open to any other resources. So it's easy to switch between one language and the other language, which I think is important to highlight this. Yes. And the other thing that I want to mention, this is being created by CHWs for CHWs. So they have been part of the centralized this. So really, this hub is more like it's more than a website. Dan, this is how I see it. It's a living ecosystems to offer CHWs access to resources, many resources. So we have interactive games. We have visuals. We have PowerPoints. We have Excels in how to do an evaluation of performance to CHW's programs. We have I think we're moving forward in the next cycle. We're going to be releasing how you can create your profile as a CHW. So if you do this many hours, you can upload it, and the profile is going to be creating, because as the CHWs, they do a lot of work, and sometimes they don't have a centralized place, but they can just, hey, I just complete this, or I just did this, and they can create their own portfolio that can be shared. We have a Luz, who is our AI assistant, really supporting AI. I have these questions, so you can find resources. So really, this is a place that CHW Voice has been at the center, and these tools that you can find there is really to support the personal, professional, and emotional growth of any CHW promoter across the world.
It's incredible, because during the pandemic, a lot of people who worked internationally found that they were grounded and had to work and were now working in the United States. And community health workers played a central role in rolling out services and addressing sort of the tragedies that we were seeing in a variety of communities during the pandemic. And a lot of them then transitioned to try to create a community health program long term. And what I saw was a lot of them were developing training programs that then were very proprietary, very private, and were only available fee for service. You guys have kind of flipped the script a little bit here. You have a product for community health workers by community health workers with all of it available for free. That's very exciting. What about this website do you think is the most exciting from your experience working in community health for so many decades?
I think is definitely this is free. We have I think right now we have around 300 resources, but I know the pipeline then is around 700 tools that will be available in maybe in 6 months. And this has been part of our. So most of the things that we have done or that is in the website is things that we have done for our own programs. Diabetes, oh, let's do that. But now was reviewed by an expert. So we want to make sure that we have an expert means a doctor or someone that expert in the topic, a mental health expert or any expert. And we have the CHW center saying this tool is needed and how we want it. And we have the design team, which is they are doing an amazing job to make sure it's easy to read and so forth. Defining this tool is what is this tool for? It's going to be for my personal development. It's for taking notes, or it's going to be an assessment. So they make sure it's available, and so this is a part of our philosophy, sharing what we have done. So anyone. Then I know, and also it's important to clarify that this is any CHW can join, but also any supervisor or any director or any agency, and how even finding resources, how to recruit, step by step, in how to implement projects, how to develop a performance reflection, performance, to have reflection conversations with my CHW, how to support CHW. So I think there is many things that is because, as you know, CHW will need to get that support to be successful from the agency they are working with, even from the area. So I think that there are resources that are not just for CHWs, but also for managers, supervisors, and people who want to implement any CHW. So I think it is not just CHW per se, but anyone who's working with CHWs can be joining and looking some resources. Even how to apply for a grant, how to develop an evaluation, how to create a strategic planning with CHWs. There are many resources that also is being enhanced to support leadership per se or programs.
I think it's so important to just really highlight how extraordinary this strategic decision was. And it fully dawned on me just as you were speaking. So I go on chwlearninghub.org. I look at the upper right-hand corner. I can toggle between English and Spanish. I now start clicking around and get access to really high quality training materials, managerial materials, strategic materials, without hitting any paywall, at least immediately. In many other places, you click and immediately you hit a paywall and says, if you want this, our stuff is the best. And if you want it, you have to contact us to get a contract going. And the contract's quite expensive, which while it looked like, there was going to be significant federal funding and otherwise for community health programs. And in a way, you saw groups starting to plan plant a flag on it, whereas really I think what I'm hearing in what you're describing is that community health worker technologies are something that was developed by community health workers themselves at the grassroots. And so to put it behind a paywall, to make it a sort of a profit generating enterprise can be quite tricky. You guys are going in a very different route. I even noticed on CHW Learning Hub that El Sol per se is not very heavily branded. What can you reflect a little bit on exactly what is your thinking and feelings around these strategic decisions?
Yeah, I think has been a lot of back and forward and with the team. Definitely, we need to develop a sustainability plan to sustain these, which we already have some plan, but really to provide free resources to CHWs. So CHWs are not going to pay for any of these to use this, because we believe they have a place to find a home per se. Oh, this is my home. This is what we really want to have, home for CHWs. They can find resources, they can get support. We have a lot of mental health tools for them, because they are already overwhelmed. They already have too much stress. So they can find here some tools in how to do boundaries. Because so for us is really finding a place for any CHWs across the world. This is my home. So it's not gonna be a fee for service or any charge. So I think they deserve to get free resources. And now, if an agency or an association wants to use or enhance this tool, definitely we're going to be charging a little bit for us to keep sustaining the work. But really, is an important decision that was done. And then I think just getting excited how many people have been. We released this on June 2nd, if I'm not mistaken, on June 6th. And almost 20 days after, we have a lot of movement on the website, people calling us, praising our work, saying this is a great job. That's the fulfillment for my end. Hey, it was worthy to do almost 2 years of work, or a little bit more.
I love it. And you and I met in a variety of contexts, but share an advisory position with another website, chwcentral.org. I also understand that the CHW Learning Hub will have a landing page there that will connect back to this Learning Hub. Do you want to say a word about that?
No, I think CHW Central has been crucial. Actually, that was when we started doing the gap analysis and what exists. CHW Central was the first website, but really it was more resources for scholars of highly people. Hey, this is the data, but you know what? This is for decision making. So we were not able to find a place, really a place for CHW. If you look at it in Google and start looking, it's more resources for the studies and tools for high level, but not really for the CHW who's in home or in the streets. So and then I will reach out to CHW Central, and then I think I present this project maybe 2 years ago, and they get too excited and they will be behind of us, saying what you guys need. Like, for example, we get an advisory group that CHW Central help us to find people from Africa, people from Australia. I think we have an advisory board from 7 different countries in English and 7 countries in Spanish, and to guide the strategic planning. What do you want to see the website? What is needed, so forth. So it was very, and since then we have been working with CHW Central to the point that they want to host this in their landing page. So it was very excitement connection when I share this with them.
And I think it's exciting and underscores the spirit and heart of community health, which is we're better together, we can share, let's make things open. And the sustainability plan is an important one, but I hope that listeners to this podcast and also folks that come to your website will, if there's an opportunity to contribute and collaborate and to elevate, I think that this resource is of enough value that it will be adopted by the community. It
Yeah.
also is important to recognize that, as I was saying before, during the pandemic, there was this growth of interest in community health. But like many of the insights that we gained during the pandemic, they were short-lived. A lot of people retreated from those commitments to equity, to communities, to each other, perhaps even to science. And instead, we're seeing a sort of a rebound, a retraction,
Mm.
so to speak. And of sadly, those who are being affected the most by this are the people least able to actually weather these challenges. First, the patients or the clients, and then, of course, our community health colleagues. We know dozens that, I'm wearing a shirt right now that says community health workers are not made, we are born, which was gifted to me by my colleagues at the NASHWA, the National Association of Community Health Workers here in the United States. But if you're born into a role, but no one will pay you long term to do it, that can be quite heartbreaking. What are some of your reflections from working with the CHW Learning Hub, with El Sol, the context from Colombia, then to California? What's your impressions about what's going on now, and what are you seeing on your
Yeah.
side?
No, thank you. And a few things. Actually, we have an anthem that was played in Nashua. Actually, that was the anthem theme is "We were born no made." So by the way, I just want as an announcement. So in
Love
case you
that.
wanna, and we play across the nation. But and because someone from Nashua was part of the anthem
Mm,
decision. It was like 17 people. Okay, but let's go back with the question. I think uh, this is real, but and also painful. CHWs were praised per se during COVID, but right now many of them are laying off on lack of recognition. Their funding attention has been shifted to another place. Uh, uh, but I think that's kind of our commitment is, even the funding
mm,
is not there, we
mm.
should be doing that. And then I think that will be an opportunity to reflect who really, definitely we need to have the funding. It's super important, but I believe funding will follow the vision.
Yeah.
So I will launch this without funding, and funding will follow in us. We will find the funding to do it, versus doing this because the funding is available. So it's not sustainable because when the money, that's the same philosophy with CHWs. Even how many CHWs have been doing this work with no funding before COVID. COVID came, provide an opportunity, training, funding, but now many of those opportunities are leaving. But I think the commitment of many of us to keep doing this work is still there. Definitely, we understand the funding is important and that it's an important piece, but I think the commitment will keep our work moving with or without the resources per se. Um, and then I think this is resiliency. I think this workforce has been, if you go through all of this the story for many years, because this is not new. This is even many centuries ago.
Yeah.
Uh, it's uh, it's a resiliency, and then I think this website or this CHW Learning Hub is part of creating sustainability support
Mm.
for CHWs, uh, and even with the funding disappears, our commitment will be there. I know it is hard, but I think uh, it will be, we will be see how who can support us. The
And
support will come.
I
Will come.
I see it loud and clear, and I think that we experienced directly, firsthand, how community health workers made incredible contributions to getting out of the COVID-19 pandemic. It's forgotten, but the truth, it was true. Community health workers are very well positioned to be rediscovered on a regular basis. And that resiliency, I think, speaks to one, why we love working with community health workers and in community health. It goes to the core of how populations have been in resistance for centuries, have survived despite regular existential threats. I think a lot of people right now are experiencing threats, especially people who previously might have been in a much more privileged position. And this is yet another place where community health workers can teach us a great lesson. How do we stay resilient? How do we keep the fire alive, right? Despite these strong headwinds and terrible, terrible downpour of existential threatening rain. I guess I would say, what advice, or I would ask, what advice do you give our community health worker colleagues, those who are working with them and are facing these challenges in unprecedented ways? What advice would you give them right now as we wait for the next time we're rediscovered?
No, I think that's don't give up. Don't give up. That's my advice. You matter. I
Yeah.
think, especially with these times that we're living, I believe CHWs are the heartbeat of public health and community transformation. So if you are a practitioner or you live your live experience, your story, your cultural beliefs and knowledge cannot be replicated.
Mm.
And so we are unique. All these workforce is unique, and so I think that's the first piece I want to say. So the second maybe is keep learning and stay connecting.
Mm.
Keep, because I think getting together, we can elevate the voices of
Mm.
CHWs and
Mm.
advocacy and mobilizing. So so that's a kind of so get connected to the CHW learning hub as well, because I think we can do something that's bigger if we can organize. Yeah, and then I think the last piece I will say, those who support CHWs stand with them and with us.
Mm.
People that maybe are not really doing the work, but people that are behind. So we can advocate for funding. We can include CHWs in policy, uh, and stay with people like agencies and people who really do this work from their heart.
Yeah.
And yeah, so I think when CHWs thrive, community flourish.
Yeah.
And then I think that's super important.
And that's a beautiful byline that you guys have on the website. And of course, the corollary is there too. What happens if CHWs are ignored? What happens to communities? I mean, some phrases that come to mind that I think might help folks that are listening and that attach to the great advice that you're giving is, when you're thrown into a labyrinth and the lights get shut off, how do you find the exit? Well, there's a couple of different strategies, but one way is to not look for the exit, but to just look for each other. Because I think that when you are in the labyrinth, together we can be stronger and we can find our way out. And in the meantime, it's probably a lot nicer to be lost together than to be lost alone. On top of that, I think in the meantime, the trick to sustainability is to build things worth sustaining. A lot of times people think that the trick to sustainability is to build things that are cheap, low cost, but that often means low value. You guys in this wonderful learning hub have created something that I think is worth sustaining. So I think people will fight to sustain it. We've seen that across a number of experiences in implementing programs across the world. The things that are worth sustaining get sustained. Sometimes the things that look sustainable because they're cheaper, when they get threatened, people are saying, well, what was worth it? And I think that the heart of community health is worth sustaining, and I agree. Let's stay together. Let's keep the fire lit. And when we get our next chance, the next pandemic, the next calamity that befalls, they will be knocking on the community health worker doors otra vez, as they say.
Yes, yes. It's true. And I think because another trend that we see, Dan, is because, as you know, pandemic increased the workforce, per se, the number of workforce. Recognition fund is a lot of, so there is a lot of, there is a big opportunity to supporting all of these CHWs that are now unemployed or they are disconnected. So I think this hub also can be connected. Okay, I'm gonna be keeping connecting. Actually, the hub is also have the capacity to support CHW networks or associations. So you can be, so for example, if you are part of an association and the association wants to use the CHW Learning Hub, we can link any CHW to that group, and it will be a subgroup that when you log in, you're going to be finding, oh, my group number one, I have access to this group, which is the CHW association. Or I have a group with this training entity who is really using the hub as an infrastructure to support the network. So I think getting connected to these kind of tools, and because I really believe that even right now, the situation that we're facing, we still needs to be connected and keep learning, because I think this workforce is a solution of many of the issues that we are facing. So I think that's super important to keep in mind, that even though maybe a CHW doesn't have a job right now, let's keep connected, let's keep learning, let's keep, because I think that is going to help getting together to keep the work and mobilizing and so forth.
Well, now they have an incredible landing page for that, to keep the spirit alive, to stay prepared, to continue to grow in this mindset. I think the field of community health is indebted to you guys. I'm personally a big fan, and I'm really glad. Thank you so much for participating in this short but really.
Thank you, Dan, for having us today.
Cheers.